So now we will discuss about the further portion of this Kasa Roga. Okay. So further in the Kasa Roga, what we have to consider is another important consideration, especially in case of children, is immunological consideration. Okay. Immunological consideration, because it is very clearly told that Pratishayat Kasaha Kasat Rajayakshmaha. Okay. That means the infection always starts from the upper respiratory tract, what we call as upper respiratory tract infection. When there is upper respiratory tract infection, actually your oral cavity and the lower tracheal tree is not involved. It is only the involvement of the nose, nostrils, and then postnasal area. Okay. So therefore the symptoms, or what is the symptom there in case of upper respiratory tract infection? The major symptoms will be there: nasa naha or nasa srava, nasal secretions in the form of rhinorrhea, or else there is nasal obstruction. These are the two only symptoms when there is an upper respiratory tract infection, which is called as pratishaya. Okay. Of course, dushta pratishaya is different. It is only called as pratishaya. Okay. In the pratishaya, there is no cough at all. In the pratishaya, simple pratishaya, not dushta pratishaya, there is no cough, because it is indicating that there is only the problem in the upper respiratory tract. Usually cough will not be there when the disease is present in the upper respiratory tract. In the upper respiratory tract, the two important symptoms will be either nasa srava and nasa naha, nasal blockage and nasal secretion. So that itself suggests that it is called it is a upper respiratory tract infection. Once the cough starts, so that suggests now the disease has into the lower respiratory tract infection. Okay, because we know that cough receptors are present in the tonsillar, cough receptors are present starting from the upper part of the trachea and some portion of the larynx, and then the trachea, tracheobronchial, and some portion of the right and left bronchus. There only the cough receptors are present. Therefore, once there is appearance of cough, means now it has touched the lower respiratory area. Okay, so when the pratishaya is over, when the pratishaya is not treated, it may lead to Kasa, that is lower respiratory tract infections. And now, if the lower respiratory tract infection is also not treated, that now the disease enter into the lung parenchyma. Lung parenchyma. That means through the alveoli, through the bronchus and tertial bronchioles, it reaches the lung parenchyma. So that is called as Rajayakshma. That means Rajayakshma is a disease of lung parenchyma. Okay, cavity formation and many things are there. Okay, so it's a Rajayakshma. So this is very shortly and sweetly told in Ayurveda, that if you neglect an upper respiratory tract, how the disease go on spreading into the lower respiratory tract. Okay, so Pratishaya, it indicates upper respiratory tract infection, Kasa, it indicates the lower respiratory tract infection, and Rajayakshma, it indicates the parenchymal involvement. Rajayakshma is not only tuberculosis. Okay, many other things are there. So now this has to be understood. Now, if you think about the adults, when we talk about the adults, a Pratishaya, upper respiratory tract infection, cannot be so easily get converted into lower respiratory infection, and even the lower respiratory tract infection also cannot be so easily converted into a disease of the parenchyma. But same is not the case in case of children, because the immune barriers are not completely developed in children. Okay, so we have got mechanical barriers, we have got chemical barriers, we have got immunological barrier. Okay, you may be knowing it. So these immunological barriers, the physical barriers and chemical barriers, so they are not completely developed in children. Therefore, transition of these three phases, Pratishaya to Kasa, Kasa to Rajayakshma, or upper respiratory tract infection to lower respiratory infection, lower to the parenchymal disease, is very fast. Very fast. That is how an untreated upper respiratory tract infection leads to pneumonia, because pneumonia is a disease of parenchyma. Lung parenchyma is involved in pneumonia. Okay, so when the pneumonia starts, the cough disappears and there will be breathlessness. Okay, so in Pratishaya, nasal discharge is more. In Kasa, Kasa is more. And in Rajayakshma, Kasa and nasal discharge both disappears. Then the breathlessness and some other problems start. Okay, so now here, as the immunological barriers are very less and immature, because we know that the T cell mediated immunity is very less in children, it takes its own time. There are so many reasons why it happens. One thing is very clear, that the immunity of the child is under challenge. Okay, it is not up to the mark. So this particular transition is very fast. Pratishayat Kasa, Kasat Rajayakshma, this is very fast. So to improve the immunity, we have to take care. Okay, therefore, one prescription in your Kasa patient is Vatanulomana Chikitsa, and second prescription should be there in your Kasa patient is, Kasa child is an immunomodulated drug. Immunomodulated drug. If the child's immunity is good, then upper respiratory tract infection cannot be converted into lower respiratory infection. It can prevent that, or lower cannot be converted into parenchymal disease. Kasa cannot be converted into Rajayakshma. Okay, so what I mean to say is immunity has to be protected, and your prescription should contain one of the immunomodulatory drug or immune enhancing drug, what we call in terms of Ayurveda as Ojas. Okay, so Ojas and as well as Kapha, both are considered with the concept of immunity in Ayurveda. One is local immunity and another one is generalized immunity. Okay, now immune system is under continuous risk and target for causative organisms. Okay, suppose if the baby has got some congenital abnormalities like deviated nasal septum, adenoids is there, or some tonsils are there, or some congenital heart disorders are there, then the child is more prone to develop recurrent respiratory tract infection, especially lower respiratory tract infections. Okay, the immunity will be under great threat. So what happens is you have to go for one immunomodulatory drug to increase the body immunity or Ojas. So this will be the second important prescription when you treat a child with the Kasa. Now, what are the common drugs which enhance the immunity that can be given in Ayurveda? Okay, Ojo Vardaka or Bala Vardaka treatment. Okay, so newborn infant, of course, we know that one of the best immunomodulator substance for the newborn is always breastfeeding. We know that the incidence of upper respiratory tract infection, pneumonias are very much at a high level in a baby which is not breastfed compared to the normal breastfed baby. The baby which is not fed with the breast milk has got more risk of this type of infection, because for the baby breast milk is the best immune enhancing factor. Okay, so that's the one thing. For the newborn, breast milk is best. And another important in the newborn and infant, always try to avoid the bottle feeding. Okay, bottle feeding is another important cause of recurrent respiratory tract infection. Not only recurrent respiratory tract infection, recurrent GIT infections, it's the most common cause. Then pollution-free environment, pollution-free environment. These are some of the basic things that we have to maintain to improve the immunity. And now, if you go with the drugs, some of the very common drugs and beneficial drugs are Rasayana drugs. We have to go with some of the Rasayana drugs. Okay, so Rasayana Sarva Dhatu Vardhanam. Okay, so now you can go for Yashti Madhu Rasayana, and you can go for Guduchi Rasayana. Okay, so one of the best thing is Vardhamana Pippali Rasayana. Vardhamana Pippali Rasayana, you can go for it. Ajamamsa Rasayana. Okay, it is also quite beneficial. Then Vasa Guduchyadi Avaleha. Vasa Guduchyadi Avaleha. Then Brihat Chagaladyagrata. These are some of the Rasayanas. Then Amrita Prashagrata. Then Chavana Prashavaleha. Then Pipalyadi Grita. Okay, these are some of the commonly used drugs. This is what I have mentioned. There are so many other immunomodulated drugs which are used as Rasayana drugs in Ayurveda. So this should be your another important prescription when you are treating a recurrent Kasa. Okay, mother is coming with a recurrent respiratory tract infection with the Kasa. Okay, it should be there. And again, you should ensure that if the Kasa is very severe, basically it is out of danger. Kasa is less and other symptoms are more, that is dangerous. Okay, so always bother about less Kasa. If the mother is telling that fever is more and breathlessness is there and Kasa is mild, cough is mild, then probably child is in more danger. Instead, if the mother says, my child is coughing very much, very severely coughing, then you ask whether there is any fever. Sir, no fever. Whether there is any breathlessness. Sir, no breathlessness. But only fever. Now, comparatively, child is on the safer side. Because when severe cough is there, the disease is only pertaining up to the upper respiratory tract, not to the lower respiratory tract. So anyway, so this is how you have to understand about this immune enhancing drugs which can be given, which should be given actually, in any child with the recurrent respiratory tract infections with the cough. Okay. The first thing what I told is about the Vatanulomana treatment, isn't it? So Vatanulomana treatment should be given, but I simply told Vatanulomana treatment, but I have not mentioned which type of Vatanulomana you want to give. Now you have to correct the Apanavata status. Okay. So one thing is Ushna is always Vatanulomana. Okay. Ushna is always Vatanulomana. And especially Amla Rasa is also always Vatanulomana. Therefore, in Kasa Chikitsa of Charaka, you can find Matulunga Rasa in many conditions. Okay, so you use Matulunga Rasa more in the treatment of Kasa. So any Amla Rasa drug, so they are also best Vatanulomana. Okay, that's the one thing. And you can go for Apamarga and Haritaki. Simple Apamarga and as well as Haritaki. So that can be given. Next, for the fauna, simple give hot water. Ushna Jala is a very good Vatanulomana. Okay, hot water with the ginger or shunti. Or if you can go for Agastya Haritaki. That is Haritaki is there, that causes Vatanulomana. And same Vatanulomana can be also done by locally by Abhyanga also, because Abhyanga is also Vatahara. Okay, Bruhat Saindavadi Taila. So Abhyanga we will do over the Bruhat Saindavadi Taila over the chest area and abdominal area. So that is not only acting as a chest physiotherapy, but also it is acting as a very good Vatanulomana. Okay. If you talk about Taila, Taila is also Ushna and Snigdha. Taila, the nature is Ushna Snigdha. So that therefore it is also Vatahara. Snigdha is also Vatahara and Ushna is also Vatahara. So that can do that. Then many of the Shodaka drugs, so they are also having Vatahara property. Okay, so if you go for this Vatanulomana treatment, then what happens? Half of the severity of the symptoms of the kapha will going to reduce. You can try it because the basic pathology of this itself is Adaha Pratihato Vayu Urdhva Shodha Samashita Udana Bhavamapanna. Apana Vayu getting converted into Udana Vayu Gati. And you have to correct the direction of the Apana Vayu, the things will be get corrected normally within no second. Okay, so that is one of the very important aspect of the treatment of Kasa. Now next we will go to the next important part.